People don't consistently follow their physician's advice, especially related to changing a health behavior like quitting smoking. In fact, 50% of people do not follow long-term medication regimens. Research shows that people are more likely to change a behavior if they arrive at plans that fit their own personal goals and values. Enter motivational interviewing, a person-centered, collaborative way to strengthen a person's own desire and commitment to change. Motivational interviewing aims to help people explore and express their goals, values, and aspirations on their own terms. The person, not the clinician, determines the need and importance for change. A clinician conducting motivational interviewing listens to the patient, working to understand what is important to the patient and why he or she might be ambivalent about changing. Then the clinician guides the person to develop a plan on his or her own terms. It only takes a few minutes. Motivational interviewing is not just a series of techniques about changing someone's behavior or educating someone. It's not about persuading people to do things they do not want to do. People have to change on their own and cannot be manipulated into doing so, even with the most effective interventions. Motivational interviewing is a way of being with a person. It's about the partnership between the provider and the patient or family member. Motivational interviewing has 2 stages: building motivation for change, developing, implementing, and maintaining a plan for change. When using motivational interviewing to help a family member reduce their smoking, try to develop an interaction with that person so they feel comfortable discussing the pros and cons of smoking with you. Do this by exploring their emotional attachment to smoking in a non-judgmental and neutral manner. Explore the risks and benefits of changing their behavior, with the intent to increase their commitment to change. How to use motivational interviewing in your practice. First, set the agenda for the discussion. This is a collaborative process between you and the individual. It allows the individual to identify what he or she would like to discuss.
What were you hoping to talk about today?
This allows the person to prioritize what is most important to them. Always ask permission before discussing a topic.
I know your child has been to the ER several times because of her asthma. Would it be okay if we talk about that today?
When setting the agenda, prioritize multiple concerns and agree on what you will discuss.
I know you're worried about your child's health, and I'm glad you brought her to see me today. I know last time we spent a lot of time talking about the stresses that you've been under and the difficulty in quitting smoking. What would you like to talk about first today?
Once you set the agenda, begin using the foundational skills of motivational interviewing. The most important of these are the OARS skills, or an open-ended question asks for more than a simple one word or phrase to answer. While simple, open-ended questions can be difficult and they are not always a natural way of engaging in conversation.
I know it can be hard to talk about smoking every time you come in for your child's visit. Thank you for being willing to talk about this with me today. What thoughts do you have about sort of cutting back on your smoking?
I know it's a good idea. I've tried to quit in the past, but it doesn't work.
What types of things have you tried in the past? What worked, what didn't work?
The goal of an open-ended question is to understand meaning rather than collect facts.
It was easy for me at home when I was around the kids. I just didn't want to smoke in front of them. But when I went to work or I was around my friends, it was much more difficult.
The open-ended question helped the provider learn that this parent already understands and values the importance of not exposing her child to secondhand smoke, which can be reinforced and used to help motivate behavior change. Open-ended questions help the patient feel more comfortable in discussing their smoking behaviors. And they provide much more information for the provider to use for the rest of the visit. Affirmations are statements that recognize an individual's strengths. They build confidence in one's ability to change. The most important and sometimes difficult thing about affirmations is that they must be a genuine statement. Whenever using an affirmation, you must genuinely believe what you are affirming in the patient.
I want to start our conversation today by saying thank you for being so open to talking with me about your smoking.
I think I could quit if I wanted to, but I don't think I'm ready to, not entirely.
I can hear you're confident about your ability to quit smoking. That's really important.
Affirmations do not always have to be a compliment. Sometimes they are simple acknowledgments of what someone is struggling with and/or praise for their willingness to discuss these struggles with you. Remember, once you have set the agenda for what you will discuss, begin using the foundational skills of motivational interviewing. The most important of these are the OARS skills, or reflective listening is the key to motivational interviewing. The best motivational advice is to listen carefully to your patients. They will tell you what has worked and what has not, what has moved them forward and what has shifted them backward. Whenever you are in doubt about what to do, listen and reflect back what you have heard. Reflections communicate interest and attention. They do not always have to add much beyond what the person has already expressed to you. One of the most common barriers for providers in practicing reflections is the fear of having misinterpreted what someone is saying. It is okay to be wrong. People will clarify for you and give you more accurate information, creating their own change talk. Reflections provide patients with a different way of considering what they have said or what they are doing. They also help to reduce the likelihood of resistance and encourage change talk.
I could definitely quit smoking if I set my mind to it, but I'm not ready right now.
Through the use of a reflection, the individual was able to clarify their belief in changing their behavior and provide evidence of motivation that can be discussed further. Summaries involve distilling the essential parts of what someone has said, and then communicating that information back to them. Summaries help people organize their experience and reflect on the discussion. Good summaries are succinct and selective.
We've talked about a lot of things today, including some of the benefits of smoking. Although it's important for you to feel relaxed, you've also pointed out some of the negative impacts that it has on your daughter. You're not ready to fully quit, but you're confident that if you put your mind to it, it's definitely something that you could accomplish.
Summaries are a way of wrapping up a discussion and creating an opportunity to reflect on progress that has occurred in the discussion.
The main reason we've talked about this is because of your commitment to your daughter and the importance of quality time between the two of you. We've discussed a number of strategies that could help you reduce your smoking, including hanging out with your friends who've already stopped smoking, and then spending time with your daughter during times where you would typically smoke. Does that sound like the plan that we discussed?
Through the use of the foundational skills, you will begin to elicit the individual's change language. The goal is to reinforce and build upon this language to help develop action steps and a plan.
When discussing smoking with an individual, ideally the individual would think about his or her behavior. Acknowledge the consequences for that person and others. Feel confident about quitting or cutting down. And initiate change. But what if smoking is their coping mechanism for dealing with stress, like the stresses of having an ill child? Or they feel that they can only function with smoking as part of their routine. It is common for people to be resistant to change. And it is common for people to resist persuasion from others to change. Sometimes providers encounter resistance from individuals who express a willingness to maintain their current behaviors, low confidence to successfully initiate and maintain change, or a satisfaction with their current behaviors.
You know, it makes me mad when people try to tell me what to do.
Yeah, I guess, but it's not something that I want to do. I don't want to do it right now. I will decide when to do it. It's really none of your business.
It's hopeless, really. I've tried before. Seems like there's no point in changing now.
In order to successfully initiate change, the provider will need to learn skills to help the individual feel motivated and confident to change. Providers should improve how they help individuals voice their own arguments for change. Why do individuals resist change? Fear of failure or fear of disappointment play a big part in an individual's resistance to change. Disagreements can also occur when there is a discrepancy between what an individual knows is best for themselves and others and what they are actually doing. For example, individuals might know that their smoking is putting their child's health at risk, but because of addiction and the difficulty of quitting, they become defensive. Some people may have little hope that change will result in a better situation or is even possible. Individuals might also directly resist by disagreeing with the provider when discussing a particular behavior or when a behavior occurs. There are some things you shouldn't do when an individual is resistant. Do not try to convince an individual that they have a problem. Do not argue for the benefits of change. Do not tell someone how to change. Do not warn them of the consequences of changing. It is natural for providers to want to fix problems, especially in regard to an unhealthy behavior. This is called the Righting Reflex. This usually comes from a good place. The provider feels comfortable as the health expert, making recommendations, as well as responding to the competing demands often felt by providers such as time constraints. But that approach will likely cause resistance, no matter how well-intentioned the provider is or how helpful the information. This is because it's on the provider's terms. To be successful, it is truly up to the individual to activate his or her own change. As providers, we should work on improving how we will help individuals voice their own arguments for change. Individuals are more likely to respond to their own voices than someone else's. The problem with the Righting Reflex is that it does not consider the process people go through to initiate change, and it puts providers in the wrong role. Smokers, for example, know that their smoking is harmful, but they also enjoy smoking and do not want to admit to hurting themselves or others. The right way to respond to resistance is to roll with resistance. The goal of the provider is to minimize resistance by not actively fighting against resistance.
It's important to hear that you are a little worried around, how is this going to work? I tried this before, what kind of new things could we think about and talk about that might make it a little more confident?
The goal is not to quiet a provider's expertise, but instead empower the individual to come to his or her own decisions about making a behavior change. You can respond to the person by asking questions instead of telling the person what he or she should do. By asking appropriate and appreciative questions, people might begin to see their behavior as harmful and as something that needs to change. When encountering resistance, consider using reflective statements.
You've been smoking for a long time and you feel like you have it under control. You're under a lot of stress right now, and the cigarettes is how you handle that. Without them, you're not sure you can handle the stress. Smoking helps you deal with all of your stress right now, and you're thinking about stopping because you know it's not good for you and your children.
It is important to give individuals the chance to assess their own willingness, confidence, and readiness to change a behavior. You can use rulers and scales to numerically score these factors. The individual can assess his or her own progress while taking responsibility for changing. First, start with explaining the scale or the ruler. and asking the individual to score his or herself.
On a scale of 1 to 10, what number would you say best reflects how important it is to you to quit smoking? On the same scale, how confident are you that you will be able to make this change?
Now ask them to reflect on their past and score his or herself.
Using the same scale, what would you say your number was a year ago?
If there's a change in the scoring, comment on the change to elicit dialogue around the reasons for change.
Oh wow, okay. So last year you were at a 4. How did you get to a 7?
A provider can also use the information to elicit value statements, or past successes or failures, and to also elicit how the individual sees themselves after making the change.
So you're at a 7. 1 out of 5 or a 6?
Things have changed for me. I just had a baby.
With that information, you can inquire about steps necessary to change.
Now you're at a 7. What could we do to maybe move you towards an 8?
The next step is to ask the individual to assess the things that might be hindering change.
How would things look different if you were at an 8?
Finally, you can ask about goals.
6 months from now, where would you like to see yourself on the scale?
You can also use the scores to develop discrepancies between an individual's current behaviors and their expressed values and interests, as well as discrepancies between importance and confidence. This is a great opportunity to discuss the difference and elicit useful information about the person and their behavior. One way to empower individuals to make change on their own terms is to ask permission. Only offer information or ideas after the individual feels they are ready to receive it. It gives them a chance to prepare, listen, and decide whether or not they want the information. Remember, the person is an expert about their experience, and they should decide when they want to talk about it, and in many cases decide when they want to talk.
I have some information here about the quit line in Colorado. Can I share it with you? I've worked with other parents who have had similar difficulties. They came up with some pretty good ideas. Would you like to hear them? I can see how important this is to you. I'd be happy to share some ideas of things that might help if you'd like.
It is important to remember that it is not necessary to use all these skills in one visit, and it is normal to revert back to our default settings, offering advice and trying to fix problems. But with these skills and a lot of practice, hopefully you can use them when appropriate to improve dialogue during your interactions. In order to effectively initiate the dialogue necessary to activate people's consideration and motivation to change behaviors, it is important to be familiar with the stages of change. In the context of improving health outcomes, the most important thing is how someone feels about a behavior, and not necessarily the consequences of that behavior. For example, in the past, we've talked to people about the consequences of their smoking.
Do you know that smoking leads to cancer?
But what we might do instead is to consider attitudes about the behaviors, like how the individual feels about buying a pack of cigarettes, finding a place to smoke, and lighting up the cigarette.
How do you feel about finding a place to smoke?
It is important to talk to them about their immediate feelings about the process. It is okay to ask about the consequences of smoking that are unique and specific to their own personal experience, like the financial burdens or how they feel it could affect their own children. That is not to say that cancer is not a personal and serious consequence of smoking, but talking about their child can be much more effective to activate behavioral intention. These are head versus heart statements. Head statements tend to be more about obvious and common consequences of continuing a behavior.
I know I could get cancer if I don't stop smoking.
A heart statement focuses more on unique consequences specific to the individual that involve an emotional response, like watching their children grow up, or the desire to be a better role model. Using motivational interviewing techniques, we can focus on the things that are within a person's control, the barriers that they can manage and hopefully overcome, and the healthy and important motivators for change. It is not always effective to try to change someone's behavior by warning them about long-term consequences. Instead, the individual should identify those factors that are immediately relevant to them. A person may not feel a cancer diagnosis is under their control, but they may perceive that they have some control over their smoking. change happens over time, and it's not linear. Nor is it a single event. As a person attempts to change a behavior, they move through 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. Definitions of the stages vary depending on the behavior. Depending on the stage, people need resources, information, and motivation. Because the stages are not linear, people sometimes fall back when facing barriers. Pre-contemplation is when someone does not recognize their behavior as problematic. Contemplation is when someone is thinking about changing their behavior. But it could also be the individuals coming to conclusions about the necessity of changing their lifestyle or a particular behavior. Doubt, uncertainty, fear, self-assessment, and is often not shared with others. Often, people linger in the contemplation stage. During this stage, it is crucial to identify those uncertainties, set goals, challenge identified barriers, and offer support. Preparation is when someone is taking steps to make the change or modify their behavior. This could be researching, buying tobacco alternatives, or even getting a prescription. In this stage, an individual needs help developing and implementing action plans and additional goal-setting strategies. Action is when someone has made specific, overt change through modifications in their lifestyle. This is a stage when the individual implements their plan, such as using the patch or calling the quit line. Here, providers can assist with feedback, problem solving, social support, and reinforcement. Maintenance is when an individual has maintained their behavior change for more than 6 months. This is the end goal. People are less tempted to relapse and are more confident that they can continue their changes. People who have recently quit smoking will experience a 45% chance of relapse in the first 6 to 12 months after quitting. The chance of relapse decreases to 10% after 5 years. The stages of change help us tailor our approach when working with individuals. For example, when someone is between pre-contemplation and contemplation, we can direct inquiries to attempt to raise awareness or guide them to visualize themselves as non-smokers. Motivation is important for making the initial decision to change behavior, as well as going through the processes required to activate the change. For example, for a current smoker, it is much more than deciding to quit. It's about goal setting, preparation for relapse, finding the right kind of support, and changing their attitudes about the actual behavior, and not just the outcomes. When talking with individuals, it is important to try to understand how ready they are to change or modify their behavior. Recall the benefit of using scale questions. Ask individuals, on a scale from 1 to 10, how important is it to you to address your smoking? And how confident are you that you can make some of the changes we have discussed today? You can also use open-ended questions to learn how important it is for them to make the change. How important is it for you to make changes? Explore with the individual what they like and dislike about their current behavior, including what they feel they would gain or lose from making changes. This can be useful for identifying barriers, goals, and values, and to elicit change talk from individuals. If a person informs you that they are ready to make changes, talk with them about what changes they feel most confident or comfortable making. Start talking about resources, practices, and new behaviors that can improve their health. But remember, they know their capacity to engage in change and what will work best for them. Initiate this process with open-ended questions, such as,
right now, let's talk about a few things you think you can do to start this process.
This does not mean you cannot offer possible courses of action. And if they ask for advice, engage in dialogue about the process.
I feel confident I could quit smoking. I'm just so overwhelmed. I don't know what to do. What can I do first?
You know, first of all, I want to acknowledge how confident you are. And it's wonderful to know that this is something that's important to you. I have some information that we have here, plus I've got some steps that other parents have taken to do the same thing you're trying to do right now. If you'd like, I'd be happy to share that with you.
But remember to ask permission before offering advice. Make it clear that these are just suggestions, and they have no obligation to agree, and they are not required to follow the suggestions. The individual should be an active decision maker in the process, and they have the final say in all matters of their behavior change. It might be useful to ask about previous attempts to change their behavior, both successful and unsuccessful, to try to increase confidence and prepare for barriers to change. Focus on small changes that seem achievable. If a person succeeds with one small change, they may feel they can face others. Quitting smoking is a major change, so it may be easier to break it down into smaller, more achievable tasks, rather than changing all at once. There's usually a point during an encounter when a person needs information. It could be about strategies, medications, or what they should do about their health in general. When someone is not using motivational interviewing, the patient passively receives the information. For example, the provider might say,
Look, because you smoke, and let's be honest, you smoke a lot, what you need to do is you need to stop doing it. You just need to quit smoking, okay? And more importantly, you need to make sure that nobody in your family is exposed to secondhand smoke.
the provider assumes that all the person needs is to know the what, why, and how about changing a behavior. But people are less likely to initiate behavior change if they are not active participants in the dialogue about the change. Motivational interviewing is designed to exchange information, instead of simply providing the information to the individual. The Elicit-Provide-Elicit strategy finds out what the person already knows, provides information after asking for permission, and then finds out what the person has done with that information.
Tell me, what have you heard about the problems with secondhand smoke? Those are all true, actually. But there's some additional ones that are associated. Do you mind if I share those with you? So now that you know all this, what do you think this might mean for you and your family?
This method allows the person to share what they know already, and also allows the provider to affirm and remind the person of their strengths. And it builds on that and saves the provider from acknowledging what the person knows already. Do not feel that you have to be fully compliant with motivational interviewing. You can use it progressively, where the skills build upon each other over time. Instead, get comfortable with some of the skills and know when to apply them. For example, scales are very helpful and understandable for individuals. Motivational interviewing is not applicable to all people and all situations, and it does not always go as planned. Although the skills and frameworks can seem simple, it can be difficult to implement and requires consistent practice. But it is effective and is especially useful when a person is being ambivalent about change. The success of motivational interviewing depends on having a good rapport with individuals, understanding that you cannot make someone change, and rolling with resistance.